Today we would like to share with you NSAID's usage and updates on cyclooxygenase. Cyclooxygenase is also dubbed as COX. Role of COX was confirmed in 1973, while in 1987 existence of two distinct isoforms of COX, that is COX-1 and COX-2, were revealed. COX-1 expresses in most of normal cells and tissue and is constitutive isoform. It regulates normal cellular processes such as gastric mucosal protection, vascular homeostasis, platelet aggregation, and kidney functions. On the contrary, COX-2 initially was considered inducible isoform because its expression increases during inflammatory process. Now COX-2 is also accepted as constitutive as it is expressed in vascular endothelium, brain, kidney, and bone. COX-2 in vascular endothelium is expressed as constitutive that produces prostacyclin, which acts as vasodilator and inhibitor of platelet aggregation. In other words, it exhibits antiplatelet activity and prevents thromboembolism. NSAIDs are the mainstay of symptomatic treatment of rheumatic diseases since 1899. NSAIDs inhibit COX-1 and COX-2 activity, relieve pain and reduce inflammation. But, as you know, safety is a major concern with their usage. Based on COX specificity and selectivity, NSAIDs can be classified into four groups: preferential COX-1 inhibitors, non-selective COX-1 and COX-2 inhibitors, preferential COX-2 inhibitors, and specific or selective COX-2 inhibitors. Preferential COX-1 inhibitors such as piroxicam, indomethacin, and naproxen, and non-selective COX-1 and COX-2 inhibitors such as diclofenac and ibuprofen inhibit both COX-1 and COX-2 in the body, thereby reduce inflammation and relieve pain, but at the cost of GI upsets, including peptic ulcer bleeding or PUB, are the most troublesome side effects. Increased bleeding time, hypertension and edema, and condor destruction. Preferential COX-2 inhibitors such as meloxicam and nimesulide are relatively safer than non-selective inhibitors of both COX. However, usage of nimesulide is associated with increased risk of hepatotoxicity. Peptic ulcer bleeding or PUB is the most troublesome GI side effect, which restrict the long-term usage of non-selective NSAIDs. According to the American College of Gastroenterology, this is not a minor risk, with millions taking NSAID pain medications every day. It is estimated that more than 100,000 Americans are hospitalized each year, and between 15,000 and 20,000 Americans die each year from ulcers and gastrointestinal bleeding linked to NSAID use. Virtually risk of GI adverse effects associated with COX-1 inhibition led to the development of selective COX-2 inhibitors. No doubt, their usage was relatively safe in terms of GI adverse effects. But due to the inhibition of constitutive COX-2 in vascular endothelium, they reduce the synthesis of prostacyclin, which results in the increased risk of thrombosis. This is the reason why rofecoxib and valdecoxib internationally have been withdrawn, and celecoxib has also been withdrawn in some countries. In this scenario, it was needed to develop such NSAID that has a specific action only at the inflamed cell and spare all constitutive COX-1 and COX-2 in rest of the body, preserving all physiological functions. Continental Pharmaceuticals proudly presents spiano that contains aceclofenac 100 mg per tablet, is the newest approach and advancement in R&D of NSAIDs that fulfills desirable need of an effective and safe NSAID. Spiano exhibits a site-specific action because aceclofenac is a prodrug. Spiano, after absorption, gets hydroxylated in liver, and part of the drug is converted into inactive metabolite 4-hydroxyaceclofenic. Both pro-drug and inactive metabolite reach to inflamed tissue via systematic circulation. Both are hydrolyzed and activated only in inflamed tissue, where aceclofenic is converted to diclofenic and the inactive metabolite is converted into 4-hydroxydiclofenic. These inhibit inducible COX-2 in inflamed tissue and thereby exhibits potent analgesic and anti-inflammatory effect. The remaining drug circulates in the body as inactive aceclofenic and has no effect on GI tract, platelets, vascular endothelium, kidneys, bones and cartilage. Unique site-specific action of spiano ensures excellent GI safety, cardiac safety, renal safety, chondroprotection and no increase in bleeding time. We conclude with the message: certainly you will agree that spiano, due to site-specific action of aceclofenic, deserves to be your first choice for treating all acute and chronic musculoskeletal painful conditions. Thank you for your patience and sparing your valuable time.